Hey there, my name is Casey Greene. I'm a PharmD and certified functional medicine practitioner and clinical liaison of integrative medicine for Revelation Pharma. Today I'm going to be discussing IV cocktails as a general overview of different things that are available and different clinical therapies you can pursue with IV cocktails as well as safety parameters and just good general things to know in the outpatient setting. So today we'll cover what are IV cocktails, in general, how do they work, clinical support uses and benefits of various cocktails and ingredients, as well as administration options, testing and monitoring, side effects, and popular clinic protocols. So what are IV cocktails? So there's simply various mixtures of IV nutrients and pharmaceutical ingredients just delivered in a variety of sterile IV carrier fluids. So it could be different size bags, given via drip or push, all sorts of different ways for the purpose of rehydrating a patient or just for the clinical benefits or a combination of those various factors. But there's a lot of different options. So there's clinical benefits for almost any known health condition. Probably hundreds of different things, if not thousands, have been studied with various combinations of IV nutrition therapies. But at the most basic level, they can just provide good additional nutrition as well as basic hydration. So how do they work? So they're virtually 100% bioavailable. So that makes the same nutrient, say calcium, magnesium, things like that you would think of in your normal day-to-day diet. That's not a big deal. But these things become very powerful pharmaceutical level agents when they're given IV because they're 100% bioavailable. So this can compensate for poor oral nutrition or even permeable membrane, which is a significant condition affecting a large percentage of the population with over 4,000 studies on the topic. So basically that meaning, and another word for that is leaky gut, but basically meaning that nutrients don't absorb as well as they should, and certain things and inflammatory factors basically leak through the gut where it's not held together the way that it should be. So in cases like that, IV nutrition can potentially help compensate for such things. But it has a very fast impact on hydration status as well as very unique clinical possibilities. So a great example is high-dose vitamin C, which is a completely different mechanism of action than normal vitamin C, which we think of as an antioxidant for immune support and such. So you can really get into completely different mechanisms not possible by the amounts that you can take by mouth with some of these IV nutrient cocktails. So now to get into some specific cocktails, just to give you examples. So the Myers cocktail is one of the most famous and popular IV cocktails. So it's a vitamin and mineral blend infusion, and it can often be considered like a backbone therapy. So a lot of practitioners will start with a Myers cocktail and then potentially change it up or add things to that, but basically using it as a backbone to get a good foundational basis for their IVs. It's been popular for many, many decades and has many variations. There's a lot of debate, and I don't think anyone necessarily knows what the exact original Myers cocktail was, but essentially a combination of various B vitamins, typically magnesium, calcium, and some things like that. So here's an example of the Myers cocktail with innovation compounding, for example. So you've got magnesium, calcium, selenium, pyridoxine, dexpanthenol, hydroxycobalamin, B complex, and ascorbic acid. So just a wide combination of nutritional ingredients, so just a well-rounded infusion, good for support in a lot of areas. And so it's also customizable by the carrier fluid type and the volume of the carrier fluid. So one example, which is the one that I just showed on the last slide, is the IV push. So that's all the standard ingredients listed there with 18.3 mLs of sterile water added into a syringe and given via slow push, generally over 15 minutes or longer. So definitely not a fast push because it is loaded with a lot of ingredients and a high osmolarity, but can be given quickly that way. And since it's not a lot of fluid Otherwise, healthy patients can compensate for the hypertonicity there as long as the peripheral vein is okay. Then you've got an isotonic drip version. So take those same exact standard ingredients and put them in 100 mLs of sterile water, and now you're going to have a roughly isotonic solution that can be given really at faster rates, even though it's in more fluid because it's isotonic. But that's really, for example, the most sterile water volume that you would want to give with the Myers cocktail, because if you went to 250, 500, or 1,000 mLs of sterile water, you would actually at that point dilute it out too much. So let's say you went from 100 mLs to 200 mLs, you would cut the tonicity in half. So it would actually at that point potentially cause significant side effects like hemolysis. So with sterile water is very good for diluting it out to a certain level, but you have to make sure you don't mix something with too much sterile water, depending what it is. So in this case, 100 mLs of sterile water would be the largest volume of sterile water you'd want to use. Then a hydration drip. So again, those same standard ingredients, but in 500 mLs of sterile 0.45% sodium chloride solution, or also known as half normal saline. So that combination, starting with the half the tonicity of the blood in that half normal saline, and then adding these ingredients in the Myers, will get it to a nice, it'll be hypotonic but not too hypotonic, so it's nice and hydrating in that zone there. So a lot of different ways you can combine and do the same cocktail to get different effects, or to give it more quickly or more slowly, depending on what they're trying to do in clinic. So then we've got a vitamin and mineral blend cocktail, which is actually largely similar to the Myers, not the exact same thing, but it's basically a simpler 2-vial system. So here you can see what that is. So basically the vitamin blend is in one, and then the mineral blend is in the other. So those could be done as technically as separate infusions or combined together, but basically a simpler way without having all the different individual vials of all the various products. But this could also be used as like a backbone type of product that additional things could be added to, assuming you account for osmolarity and other safety factors. Then there's the Innovation Immune Boost cocktail. So this one actually uses the Myers as a backbone, but it also adds immunity and antioxidant support. So it specifically adds glutathione and acetylcysteine. And an additional optional consideration that I usually recommend is zinc, because zinc is one of the most proven ingredients as far as boosting the immune system and even potentially reducing the duration of the common cold. So zinc, just a very powerful extra ingredient that you can consider adding that's not part of the standard Immune Boost cocktail kit. But again, the backbone is the Myers, and it starts adding additional items to accomplish these other clinical means. So here's what the Immune Boost cocktail looks like. So again, the backbone is the Myers, and then it just adds acetylcysteine and glutathione. And also important to note, the glutathione is not mixed in the bag in this case due to incompatibility. The glutathione would likely be basically deactivated at that point if it were put in the bag. So what you would do in this case is either before or after the drip is given, you would administer the glutathione via slow push, typically diluted like 1-to-1 with normal saline or sterile water, and push it 1 ml per 30 seconds or so. And basically you would push it, say before giving the rest of the infusion, and then continue the infusion after that, or you could do it after, but you would not mix it in the bag. Generally, glutathione is always going to be given by itself, even if it's listed as part of a cocktail. So then we got the Innovation Standard Chelation cocktail. So this one removes excess stored toxic metals based on affinity, depending on what chelation agent you're using. So this one uses EDTA, which primarily chelates lead, is what we're going after. But here we're talking about environmental chelation versus acute chelation, like you might see in the hospital acute care setting. So this is more like patients that are otherwise healthy, but they'll benefit significantly from potentially having some of these excess stored toxic heavy metals pulled out of their system. But it does require very specialized training, And it can be very risky if practitioners don't know what they're doing with this. So they should really do a thorough diagnostic and be very careful and know what they're doing as far as pulling these metals out, because there are large toxicity risks if you pull out too much of these toxic heavy metals too fast. Because while they might not be acutely harmful where they're stored in tissues, for example, if too many of them are pulled out in the blood all at once, like too much lead coming out in the blood all at once, that can be very dangerous. So the practitioner really has to know what they're doing and the levels at which they're going to pull things off and test things. So the biggest risk with chelation is too much too fast, because that is going to pull off too much toxic heavy metals and basically make the patient toxic, whereas those heavy metals, again, were stored more safely in the tissues versus flooding the bloodstream. So you just have to be very careful with how it's administered and given. And there are renal risks as well. So there are various recommendations on how to adjust dosing for patients with renal insufficiency. But in a lot of cases, I'll just recommend to not even use chelation unless there's a very, very careful assessment of benefit versus risk. So here's what the Innovation Standard Chelation Cocktail looks like. So some various nutrients, basically trying to replenish certain things that might be chelated off. And generally, you would want to do an infusion with the chelation, again, because too much too fast is where most problems and side effects, adverse events occur with chelation. So generally you want it to be in enough volume and given over, I usually recommend 3 hours or more to be on the safer side, because again, you don't want to pull off too many heavy metals too fast. And this is a standard here, so EDTA being the chelating agent. And worth noting, there are other versions of EDTA, such as EDTA calcium, which the calcium is intended to replenish calcium, which would also get chelated off, so which would protect the heart. With a longer infusion such as this, that's not as much of an issue, but many practitioners in the past, if they were to do faster infusions with chelation, in cases like that, having the calcium salt version of EDTA could be beneficial to replenish what's being chelated off. But just note there are the two different versions and they are in different concentrations. So then we've got Innovation Vitamin C cocktails. So completely different mechanism of action when you get into high dose vitamin C, which is what these cocktails are. So we go from an antioxidant, which is what we normally think of vitamin C, to an oxidative therapy. So the complete opposite, because it starts to generate hydrogen peroxide inside the cells. So the clinical uses of this that have been studied, the main one is adjunctive cancer support, but also anti-aging for viral infections. I've even seen many clinics use it for the flu or COVID, things like that, to get down viral load through the oxidative effects. And then inflammation control. So there's a lot of studies and there's been a lot of use actually, like in septic shock with high dose vitamin C. So here you can see the various protocols ranging from 25 grams to 100 grams of ascorbic acid or vitamin C. And then the other nutrients in here are basically in there to pre-correct for shifts that will happen with these electrolytes, because what high doses of ascorbic acid will do, the body sees it like a sugar, so it spikes insulin levels, drives a lot of these nutrients, magnesium, calcium, potassium, inside the cells, which drops the levels in the blood. So that's why those are in there, to pre-correct for such measures. It's not absolutely required, but it's a more optimal way to give these. And the higher the dose goes, the more oxidative it's going to be. And this is not a fun infusion, like a feel-good infusion. It's more for the clinical benefits, but it's fairly taxing. It's a very hypertonic, dehydrating infusion. It can affect the patient's blood sugar. So, and generally these are given over a few hours. So best practices, carrier fluid type and volume. It's good to note, in a lot of cases, sterile water will be a better option with high dose vitamin C, just because the tonicity will be so high, the osmolarity is so high that sterile water can dilute it out more. But you should definitely check the osmolarity in all cases before assuming that. And there are cases where even fluids like normal saline can be adequately used. But important to note the infusion rate. You generally want to give 4 mLs per minute or slower, just as a good safety spot. That's what organizations such as A4M recommend to reduce the risk of side effects damaging the local peripheral vein, because again the infusion is very hypertonic. So, and then just patient monitoring, because it will affect their blood sugar, and it is dehydrating. So it is not as much of a pleasurable drip like just a standard hydration drip, but it can have strong clinical benefits that make it worth that hypertonic infusion if done properly. Then we've got the Innovation Hydrogen Peroxide Cocktail. So this is another oxidative therapy infusion, but it's not quite interchangeable with high-dose vitamin C. So while high-dose vitamin C actually gets hydrogen peroxide levels boosted inside cells, hydrogen peroxide infusion actually gets more of oxygenation. So it's more for oxygenation, detox, immune support in that regard. And notable, you can add hydrochloric acid not in the infusion, but as a separate slow push at 2 milligrams per ml, and that's a old-fashioned immune stimulation. So that's actually been used for decades, and even before antibiotics became popular, to boost white blood cell count and actually stimulate the immune system to activate and kind of flare up, I guess you could say. So just another additional option that you could slow push as part of this infusion. So here you can see that protocol, and again, yeah, slow infusion and hydrochloric acid optional after the hydrogen peroxide infusion. So then we've got the Innovation Phosphatidylcholine cocktails, or PTC. So it's a phospholipid exchange that it's a direct vasculature support of the blood vessels. So it actually goes through and supports the health of the actual blood vessels, the vasculature, as it goes through the bloodstream. So very unique cardiovascular therapy there, compared to most therapies that are of course taken orally and work at one part of the system here and there to control blood pressure or cholesterol, various things like that. But it also is pretty well known and studied to have cholesterol profile benefits, so optimizing various parts of the cholesterol profile. And here you can see those protocols. There's the initial protocol where they work their way and titrate up, and then there's a maintenance protocol once they've gone through the initial. And generally phosphatidylcholine shouldn't be mixed with anything else, just due to limited compatibilities. So just mention the incompatibilities, titrating the dose up, and also it's worth noting that oftentimes it's best practice for filter syringes to be used when drawing it up, just because there is a high chance of particulates. So definitely always look for particulates, and if possible use a filter syringe to draw it up. So then just a few other special cocktails worth mentioning. Alpha lipoic acid is a great one for weight and blood sugar control. NAD+, a great one for energy and anti-aging, basically a variation of vitamin B3. Then DMPS is another chelation therapy that more specifically targets mercury, because again, the various chelating agents have different affinities for different metals. So DMPS is more specifically suited for mercury. And then there's many more and many combinations. Many other ingredients could be used as the primary ingredient, or in smaller combinations, various amounts. So there's a lot of possibilities there. So then your basic administration options with IV cocktails in general. So IV push, that's one of two ways: either just your manual syringe push, which is just a slow manual push, but it'll often still be over 10 to 20 minutes depending on how hypertonic it is and how much is in the solution. And then for clinics or hospitals that have actual machinery, computerized machinery that can actually do a controlled push over a longer period of time, much more precisely. And then of course you got IV drips. So you've got central lines such as a PICC line or a port, and a few other types. Central lines, you can generally give things faster, and basically the body handles it, filters it out more quickly. But that's not going to be an option in most outpatient settings in which a peripheral line is going to have to be set up that time when they come into the office. So that's most common, and in cases with a peripheral line, you do have to be more careful of hypertonic solutions because you are more likely to damage that peripheral vein at that site. But that's the most common one with these outpatient options like this. So then some safety considerations just across all these IV cocktails. So there are ingredient variations to be aware of. So salt forms, for example, can change the elemental amount of the dose itself. So many of these ingredients will come, for example, in a chloride versus a sulfate form. And a good example is magnesium chloride and magnesium sulfate. They're not only dosed very differently, as differently as 100 to 150 milligrams per ml of magnesium chloride versus 500 milligrams per ml of magnesium sulfate, but they also have a nearly 20% difference in the elemental magnesium per milligram. So both those factors play a role in the actual dose of magnesium that the patient gets. And that applies to not only magnesium, but calcium and many other ingredients. So really just making you aware of the concept here that not only is the milligrams per ml part of the dose, obviously, but so is the salt form that is used, which will affect additionally the amount of the active ingredient that the patient gets. So then we got osmolarity. So osmolarity is a little more complex than just the milligram per ml concentration. It comes down to how many solutes actually break apart as a deeper part of the chemistry. So there's isotonic, which is basically matching the osmolarity of the blood, which generally is clinically roughly 240 to 275 milliosmoles per liter. So generally that's the safest. Those can be given pretty fast. Then you got hypotonic, so less than 240. That is so a lower osmolarity, significantly lower osmolarity than human blood. So that would be more hydrating, but hemolysis is possible if it gets too low, especially less than 150 milliosmoles per liter. And that's actually the most dangerous type of IV cocktail if the osmolarity gets too low and it's done improperly that way. So for example, you would never give just a large bag of sterile water either by itself or with only one or a few ingredients that doesn't get the tonicity high enough, because that would result in hemolysis. So then we got hypertonic solutions, so greater than 275 milliosmoles per liter would be clinically hypertonic. And the higher and higher it gets, the more hypertonic and the more it's going to have the hypertonic clinical effects. So the benefit is you can deliver more nutrients this way, but there is more risk of vein injury to the local vein, and a slower infusion is required, and it will be dehydrating. So it's just a matter of how much you need to slow it down, how much is the benefit of the various ingredients compared to the tonicity and giving up having the hydrating effect, because a hypertonic solution is not going to be hydrating. It's more about delivering the extra nutrients. Or a good example is high-dose vitamin C, which is almost always going to be hypertonic, but you're doing it for the clinical benefit and the mechanism, not for hydration. So then testing and monitoring. So of course we want to monitor the patient's physical response. Are they freaking out? Are they alert? Are they getting anxious? Are they nearly about to pass out? Because some of these, such as magnesium and calcium, can have very excitatory or relaxatory effects. Some of these can affect the patient's blood sugar. So just noticing the patient's physical response. Are they sweating? And then, of course, the patient's verbal feedback. How do they feel? And then a basic metabolic panel can be very useful and is recommended. So that way you can see what their electrolyte status is on all the various minerals, for example. And then renal function, because of course they do have to clear these fluids and these ingredients. So poor renal function could mean that things could basically back up in the system. Fluids as well as the various ingredients could become more toxic or have more ongoing strong clinical effects. And then just other based on whatever specific ingredient is being used. There's just much more than we could possibly cover here, but just as a general overview, these are some of the core ones to look at. So then some common side effects and precautions. It will vary, of course, by the actual type of cocktail, but in general, some of the more common ones might be headache, nausea, lightheadedness, nervousness, and then it's going to get down into ingredient specifics. And then if the cocktail is hypotonic, you could have pain near the infusion site, and as it becomes more and more hypotonic, especially less than 150 milliosmoles per liter, you can get into hemolysis and even blood in the urine and more significant adverse reactions there. Then on the hypertonic or more concentrated side, that's where the patient, for example, with high dose vitamin C, they'll likely see dehydration, fatigue, maybe sweating, irritation or injury to that local infusion vein from that high concentration. So then some popular clinic protocols. So again, you can always look at something like the Myers as a backbone starting point if you just wanted to have a tried and true foundation to start with, and then you can add ingredients on top of that. So for example, again, the Immune Boost basically takes the Myers cocktail as a backbone and adds glutathione and acetylcysteine. So there's many different ways you can do things like that using a tried and true, well-tested formula like a Myers, and adding on things from there based on what clinical effects you're wanting to get. You just have to keep in mind, are those things compatible in solution? What's the osmolarity going to come out to be? Is it still safe? But a lot of options there if you know what you're doing. So there's everything from basic nutritional support to using these just for hydration or a combination of hydration and nutritional support. Then there's all sorts of condition-based, condition-specific indications for using various types of IV cocktails. And then there's much more advanced protocols, like I would consider the chelation much more advanced as far as the training the practitioner needs to perform those effectively and safely. So then here we got some synergistic nutrients that can really go with a wide array of different IV nutrient cocktails. So glutathione, again, generally not given in the bag with other IV nutrients, so given via IV push before or after. But glutathione, just very strong antioxidant, very good for overall health, and just very useful in a wide array of IV cocktails. Then we've got zinc, which is a great add-on, especially with immune support types of cocktails. And then taurine is actually considered the master osmolyte regulator. So it actually helps those electrolytes to basically get in and out and control that osmolar effect to get electrolytes better where they're supposed to go. So taurine can actually help patients feel better and handle a wide array of IV nutrient cocktail infusions better. Then of course there's just various vitamins and minerals that for different scenarios you could use as add-ons or in different amounts. For example, if you wanted to make an infusion more relaxatory, you might consider adding a little bit more magnesium, but various ways that you can tweak and alter cocktails to get different clinical benefits. So then drug and nutrient interactions. So with most of the nutrients, it's going to be more condition-based versus necessarily a drug interaction, because again, most of these are in the normal diet. It's just a matter of are there health conditions that are going to affect. So renal insufficiency would affect the clearance of the ingredients as well as the fluids. So of course that's a factor. Cardiac, there are electrolyte effects such as especially potassium, magnesium, and calcium. They're going to have strong cardiac effects on how fast and how strong the heart beats, for example. So those actually have to be used very carefully via IV, just keeping cardiac factors in consideration. And then things such as heart failure will have extra fluid buildup. So when giving IV fluids, of course, that's a consideration. Can this patient clear this out? Is it going to cause more fluid buildup on the heart and in the tissues? And then blood sugar, there's considerations such as high dose vitamin C. It's going to affect blood sugar. Very hypertonic solutions, things like that might affect blood sugar, or if the IV carrier fluid is D5W, for example. So just other clinical factors to think about. So IV cocktails in summary, we looked at what are IV cocktails, some common examples, how do they work, and various support uses and benefits, administration, testing, monitoring, side effects and precautions, as well as popular clinic protocols and clinical effects that we're going after. So that concludes my presentation on IV cocktails. You can connect with us at sales@revcustomrx.com or 1-800-547-1399. Find us on revcustomrx.com, or you can find us on various social media such as Instagram or LinkedIn. And here's a list of our various network pharmacies that cover some of these different types of items and service various different states, but these are all within our Revelation Pharma network. And also be sure to check out our YouTube channel and other trainings that we have on various IV therapies as well as other therapies available through our network. So that concludes my presentation. So please feel free to reach out to us if you have questions, and we would love to assist. Thank you.